How do practices go about budgeting for the rest of the year and into 2021? Should they even bother going through the exercise?
Well, to answer the last portion of that question, should they bother going through the exercise? Absolutely. Any practice that is serious about their business, any owner that's serious about their business, should have budgeting or performance done. They should be evaluating their financials on a monthly and quarterly basis. They should be reviewing that, not only revenue, but line item expenses, reducing costs where they can, doing what they can to increase the revenue. But if they've had financials from the past and if they haven't budgeted before, your previous financials will act as a budget. You will know exactly what your actual costs have been month to month, utilize those numbers, put together a budget, and then start, evaluate if we conducted this much revenue in January and February, which obviously it may have been lighter, given the fact that you're still trying to collect copays, you're trying to collect deductibles, and that type of revenue is a little slower in coming in the first quarter of the year. So you could even use your financials for the previous year. You can go through and look at what your actuals were for each month, and then go through and evaluate that. If you have a reduction in revenue, let's say of 50, 60, 70%, determine what expenses other than fixed expenses you can possibly reduce, even to the point that maybe you're able to get some benefit or some not forgiveness, but at least some delay on maybe your lease payments, your rent payments, things of that nature,